My name is Allison Batantos, and for my Sportsmed 3 Unit 4 project, I'm doing rehab on a complete knee replacement. What is a complete knee replacement? A complete knee replacement, or also known as a TKR, is when the damaged cartilage and bone are removed and then replaced with metal plates. These metal plates then become a substitution for the joint. The injury. A complete knee replacement does not come from a definitive injury. It is commonly done for arthritis. A knee replacement is needed after the knee becomes stiff, worn out, or damaged from repetitive movement, strong force against the joint's deformities, and instability. Some things about arthritis is that arthritis is inflammation of the joint that causes pain, stiffness, and immobility. It is common for high impact sports like running, skiing, and basketball. Older people age 60 through 80, overweight people, and as is not likely as the other three, you can still get arthritis after not doing any activities for a long period of time and then just jumping back into them as your joints are basically rusty. The surgery. A total knee a total knee replacement is an invasive surgery as it removes parts of the fibula, tibia, femur, and patella to relieve pain, restore strength, and correct the joint. The full recovery time of the surgery can take up to a year, but you can resume light activities after 6 weeks. There's 4 stages of rehab or phases, and phase 1 is week 1 after surgery, so post-op. And for this, your main focus is just trying to get range of motion back, talking to your physical therapist and seeing what they recommend to you, and also managing pain and inflammation. And for this week, you're also completely non-weight bearing, so whether that's crutches or something else. Phase 2 is week 2 through week 6, and that's moving from passive range of motion to active range of motion in between those 4 weeks, introducing proprioception, functional activities, and partial weight bearing, so using one crutch instead of two. Phase 3 is week 7 through week 12, which introduces recreational activities, complete weight bearing, and having a range of motion you used to have before surgery or before your injury. And phase 4 is week 12 through week 16, which is going back to full activity and having longer and higher level exercises. For phase 1, your biggest focus is protecting the knee as it's in its weakest stage of rehab. Regain that range of motion little by little and not overdoing it. Passive range of motion, if that's help from somebody or just you doing it yourself with a towel, and decrease pain and swelling. Some protocols for this are pain management, no exercises that include resistance and weight, and patellar mobility. Some exercises to start off for phase 1 are straight leg raises, ankle pumps, heel slides, and glute sets. For phase 2, you just want to keep on improving that range of motion you got from phase 1, going from passive range of motion to active range of motion. Focus on the weaknesses in your knees and functional activity, so just walking and trying to get that range of motion back. Some protocols for this are partial weight bearing and cryotherapy. Weeks 1 through 4 are going to continue being passive range of motion and gait training to try and get rid of that limp. And weeks 4 through 6 are going to introduce isotonic exercises, so extending the length of your exercises without making it harder, and functional exercises. Some exercises for this are an LAQ exercise, using a stationary bike, just going back and forth and then moving to full rotations, a quarter lunge, step ups with the support of a chair, and calf stretch with the support of a wall. For phase 3, which is weeks 7 to 12, you start to introduce recreational activities like hiking, swimming, yoga, just light things. Having that full range of motion, the range of motion you used to have before surgery or before your injury, complete weight bearing, an endurance program to build back that endurance, and more proprioception to get used to your new joint. Some exercises for this are heel and toe raise, single leg balance, hamstring curls, and quarter squats. For phase 4, which is the last phase and the most advanced phase, which is weeks 12 through 16, you're returning to play or returning to your activities, enhancing those prior exercises that you worked on in the entire rehab, just isotonic exercises and appropriate sports or recreational activities for your new joint that aren't going to affect it or overdo it. Some protocols for this are avoid high impact sports and contact sports, and avoid heavy repetitive lifting. Some exercises for the last stage of rehab are step up crossover, a bridge, a calf stretch, and deadlifts with just tiny dumbbells, not overdoing it, and just things like that. Thank you.